ago?
That's what I've been doing all my life on bikes. How long have we been doing this?
You started to come to the office on August of 2015, I think, is
So
when you first
a
came
little bit more
in.
than a year and a half, almost 2 years. So basically, I could no longer ride. I couldn't sleep through the night comfortably without waking up in excruciating pain. I had no idea what it was at the time, but had to get some test results and found my RA number to be 408. We had a mutual friend. He told me to come see him. And we've been working on it. Probably about a month ago, I went back to dirt jumping my bicycle. So a far great improvement from where I was, where I couldn't open a bottle or open, a simple drink myself. Due to a change in diet and supplements, I'd say 50 to 75% healed from what I've done, and am able to get back to doing the things that I want to do.
Yeah, I think one for the audience, when James talks about the RA factor, he's talking about the rheumatoid arthritis factor. He had an extremely high number. Now, the medical approach obviously is immunosuppressant drugs, painkillers. That wasn't a choice that he wanted. And when James found out there was an alternative method, he was all in, which really helps us a lot when a patient wants what we do and is willing to do what it takes to have the program work.
Well, I don't understand how anyone who watches any TV couldn't see the late night explanations of exactly what will happen if you take their drugs. Because as they're advertising for their drugs, they tell you what it'll do to you. And I wouldn't be able to go back to riding a bike if I have nerve damage or loss of motion and such things that come with their drugs.
Yeah, I think that's a very fair point, because what we always try and teach our patients is to take back your life. One, you have to be in control, and two, to get optimal results, we can't try and alter body chemistry. We have to get you back to normal body chemistry and normal immune system function. And between the upper cervical care, which was very important for your care and a lot of our autoimmune patients, the chiropractic portion, and then the nutritional approach, we always feel very comfortable we can help a patient, and with their compliance, thank God for you, it worked out extremely well.
Well, what was the last test? 234 from...
Yeah, your rheumatoid factor actually halved, and this is without medication. All the inflammatory markers got normal, your immune system counts normalized. So by getting you to get on a program that allows you to restore normal digestive health and immune function health, that was the big things for you in establishing your ability to heal and your ability to function normally despite your genetics. And that's something patients always have to understand, is there is a genetic component here that nobody has control over. However, you can control the things that allow it to evolve in your life. And for the most part, when you meet someone who has an autoimmune condition, rheumatoid arthritis in this case, and you see them 10 years later, unless they've dramatically changed their lifestyle, they're always considerably worse, even with medication. And I think that's probably another thing that prompted you to say, I gotta look for a different way.
Well, that, and I knew that I wanted to be able to ride my bike again. And 2 years ago when this started, I didn't think it was possible. I didn't think I was going to be able to do what I do on a bike ever again. And it wasn't a happy thought.
Well, I'd like to see another picture like that one again soon, so.
That one is going to take me a little while to get off that jump again, but I'll take the little ones right now.
But thank you so much. So obviously, if you knew someone who had rheumatoid arthritis or another autoimmune condition, what would you tell them about our office?
Well, I mean, I knew, my father told me not to take the drugs immediately. As soon as I told him what was up, I would tell most people, yes, it's going to be a harder road, but you're going to take some drugs so you feel better but aren't better?
And our focus isn't necessarily what the medical approach is versus just what we do. And we see a lot of patients who already are on medications and are really suffering. Our goal would be to help them try and not need it, but ultimately, even with our program, medications or not, they still see amazing improvement. If we can get someone before they start the meds, that's probably more.
So you think it's actually a problem when somebody comes to you after they've already started taking the meds? So,
I don't see it as a problem. I just think that someone
It's
who
a
hasn't
harder-
started medication probably has a better opportunity to start
body's
care
better.
without that influence
yeah,
first.
Your body's better off.
Your
because
body's
you
better
haven't
off, but
taken
once
it.
they're on the medication, it's not so easy to just stop it, because there's an
dependent
effect
on
of
it.
stopping it. So our goal in that particular case is still to do what we can do to put them in a better position to have conversations with their medical doctor about whether they can decrease or stop medication. It's not really my job to do that.
Mhm.
Okay? But thank you so much for coming in, I really, really appreciate it.
No problem.
Thank you.